Hi guys, my name is Jody, fourth year nursing student at Nelson Mandela University, which is here in Port Elizabeth, South Africa. And today I will be talking about my degree of studies, which is nursing sciences. So within my course, which is a 5-year course, which is very different from your normal courses that you do get offered by universities. At the end of the 5 years, we graduate with our honors degree in nursing sciences, and we obtain our maroon epaulet with 3 bars specialties, which is our midwifery bar, our community nursing bar, and our psychiatric bar. How my course is different from others is that within the first year was a bridging year in which we did our physical science, mathematics, English, and a bunch of other modules or subjects which basically introduce us to the field of nursing. And following that year was when we got into the real meat of things, in a sense of we actually dove into what goes into studying nursing and what we actually do within the nursing field. And the second year was also the time we got allocated into the hospitals, in which I was very excited and a bit afraid of what lies ahead of me in terms of the patients that I'll be seeing and how I'll take seeing blood and seeing a whole bunch of other things that normally people don't get to see in everyday life. So I was a bit anxious, excited, afraid of all the things that I was going to see and what was lying ahead of me. But back to the nursing course itself. We did our practical and we also did our theory, and within the theory work it was also split up into theory and practical classes, in which we were taught how to do certain skills. We would have things that we call OSCEs, which is basically an exam on certain skills that we did learn, which is chosen by the lecturers themselves on what they want to test you on. Those tests can be either done on the institution itself or either in hospital. It depends on the situation itself. Regarding the practical OSCEs on which we are tested on, it's usually that you'd be in a room or you'd be with your patient with 2 other lecturers or 1 other lecturer, and they would assess you on a criteria that you're supposed to follow, and you're given the criteria of what you are supposed to do and major key points that you're not supposed to miss in order to obtain a good mark or good pass in the skill itself. And within those tests you get things that we call compulsory points, which is certain things that you just cannot miss, otherwise you just obtain a 0. And those points can be maybe checking the patient's ID, whether the patient whether you do certain things with the patient, like some skills have different compulsory points. Let's say for instance with medication, if you don't check the expiry date or you don't check whether or not this patient is actually receiving this type of medication, and double checking in the files and whatever, you actually score 0 in those points. And yeah, that's basically it for the OSCEs. In regards to the theory work, it's quite a lot and it's very overwhelming at the same time, because of you getting overloaded with new information on a daily basis. And in regards to my course, the weeks were split up into maybe 2 days at classes, and the 3 days we go back into practical work. And in those 2 days you'd be like maybe 6 different classes. So 3 you'd get on the Monday and then another 3 on the Tuesday, and with those classes they give you some tests, quizzes, assignments in order to obtain good marks, which you then use to get admitted into an exam for those 3 modules or subjects. My perspective on all of it, now being in my final year as a 4th year student, the advice I can give those that are starting out or want to go into nursing is that it's not an easy thing. It's really a calling. You have to have a passion for it to help those people, and not just go into work just because you want to obtain the degree, or go into work because you know you're gonna get a certain amount of money and you're gonna get paid well. It goes beyond further than that. You have to put in the extra mile. You have to be there for the patient, talk to them, find out what's wrong with them, form a connection, a bond with the people that you do see on a daily basis. Whether they leave and whether you see new people, you're gonna have to start that over again. Form another bond. Make sure that they are feeling like they're getting better, that they have a person to talk to. It's a lot of things. It goes more than just what you are supposed to do and your responsibilities. It stretches far beyond that. And you are gonna have to meet those expectations. Otherwise, I would say it's just not for you. But in my perspective, in regards with the theory work itself and going forward in all the new work that you do learn, like I said previously, it is overwhelming and you're just gonna have to stick to it and do your due diligence and sit with your books and work through everything, because at the end of the day, whatever you learn is in order to help others, and you cannot give 50% or 60%. It's gonna need 100% of your time, 100% of your attention, because at the end of the day, you are in charge of another person's life, and your decisions after you graduate and you become a registered nurse, you are gonna be the one that everyone is looking towards. You will be in charge of a ward. You'll be in charge of students that might also want to do nursing one day, and they in your ward. You're gonna have to be in charge of all of those things. So it's a big ask of us as a person compared to any other job that is offered in today's age. Nurses do really do a lot. Another piece of advice that I can give is that for nurses that are actually doing the course themselves, is that always do your hours. Never like fall behind on that, because it can really come back to haunt you. So do your hours when you're supposed to do them, no matter you don't feel like going to work, or you feel really tired that day, or you're just feeling a little bit down. Sometimes we do need time to ourselves, but just make sure that you don't dig a deep enough hole for yourself that you can't get out of. And in my case, I can say that because I am now catching up on hours, even in my 4th year. Hours that I didn't do in my 2nd year, in my 3rd year. So now I'm really paying the price by overloading myself in my 4th year, but I still have to push through it, and I have to still meet the requirements because of the hours that I need to pay back. And if I don't have those hours, unfortunately, I cannot graduate the time that I'm supposed to, which is next year in April. So guys, please, all the nurses out there, all the student nurses, when you're supposed to do your hours, do them. Don't think that don't go groove and go party when you know the next day is a work day, or don't do too much the previous day when you know you're gonna need that rest and you're gonna need to be on your toes when you're at work. So please be very responsible with the choices that you do make when you are in this course. For the people that want to go in it and are not in it yet, please heed my words, heed my piece of advice, because I'm here now. I'm here in my 4th year, and it's experiences and events that I did go through, and I can tell you now that that is one thing that you do not want to fall behind. Do your tests when you're supposed to, and when it comes to exams, don't miss them. Always be studying, always be diligent with your work, and strive to be the best that you can be. Do the best that you can. Another piece of advice that I can give for those who are now in the course is that always be present at work. Don't just do the things that you need to do. Okay, now you're gonna go on your break or on your tea or on your lunch. you come back and then you're just slopping around and whatever. Don't be like that. When you go to work, be present, ask questions, be with the registered nurses that are there. Ask them stuff, they're so helpful. All the nurses that I've met throughout my course, throughout these 5 years of me being placed at different hospitals and different clinics, nurses are so helpful to help other student nurses. As long as you show interest and you show that you want to be there, they will help you in a heartbeat. And these nurses, these registered nurses, they know a thing or two because some of them have been in it for years and they can teach you their secrets that can help you when you do become a fully fledged registered nurse also. Even for the student nurses that do get their skills that they're supposed to complete and certain tasks that they must do, try and go beyond that point. Learn something new at the registered nurse's discretion. And as long as they're there and they can teach you and they are there spectating you doing it and seeing that you do the right thing, learn a thing or two from them. Go beyond that point. And the one thing I can say is that just don't go out of your scope of practice with patients themselves. Yes, it is nice to learn a thing or two, but if you know that it's not in your scope of practice, do not do the skill or the procedure by yourself. Always be accompanied by a registered nurse until you're competent enough to do that skill itself. And when I talk about the scope of practice, for those that do not know, that aren't registered, that aren't student nurses, scope of practice is basically what you are allowed to do with a nurse. So for instance, if I'm in my first year, I can only maybe do a procedure like testing a patient's blood glucose level or sugar levels, or checking the amount of oxygen in their blood by doing a HP test, doing the patient's blood pressure. So all the simple tasks in the first year that I'm allowed to do, I will do. In the first year, I can't go and do patient wound care, or I can't withdraw blood, I can't give medication, because of those things are things that are out of my scope of practice and I have not learned how to do yet. So it is nice to go the extra mile and learn a few things from the nurses, but know that you cannot do anything outside of your scope of practice if it's not your time to do so. And yeah, basically from my point of view now is that from my experiences and what I've been through my course in the 5 years that I've been doing this, it is now my 6th year. I failed my 3rd year because it was hectic. In the 6 years that I've been doing this course is that never to give up and always strive to do better and always complete the things that you're supposed to complete. And throughout this course really helped me to help others outside of patients. Personally, in my personal life, I can maybe help my mother because she's suffering from things, and for some of my friends even, since I'm doing a specialty, specializing also in psychiatry, I can also talk to them and find out what's happening with them and not diagnose them because that is not my place to do so, but I can help them. Doing nursing is a real eye-opener that outside of being at the hospital and being at the clinic, you can help others. You can always lend a helping hand, and for me as a person to do that, to just help someone else, is a great blessing to do. Now that I'm in my final year, I can look back on all the hardships that I've gone through, all the patients that disrespected me sometimes, some even wanted to fight with me. I can look at that and laugh because I'm here now and they are better, you know. There'll be some times that the patients really do give you a hard time, do certain things, or they are very inappropriate, or they even hurt you sometimes, and I know that our first reaction is to bite back, to get them back, or not to treat them, or to treat them some type of other way, but they also deserve the care. They also deserve to be treated with respect and dignity. no matter what, do not deviate from doing the right thing. For this being my final year, and me doing now in this final year, I'm doing my psychiatry, and then in the second part of the year, which is July, I'll be doing my midwifery hours, which is working in the labor ward. These are things that 2 years ago I was very nervous about also, but now that I'm here, I know that I don't deviate still. I still help these people with a smile on my face, and it was very still scary for me to experience new things, because at any given moment it can deviate you and you can think to yourself it's not for you. Midwifery is something that I'm really looking forward to, with a smile and with a bit of fear. Same thing that I went through also years ago when I first went into a hospital. But I hope that my story and what I've said encourages you as student nurses, and for those that are looking into doing nursing, that it encourages you to do the course itself and to go into it with a passion. And for those students that are continuing, to still have that passion in your heart to help others and help people. Yeah, that is basically all I have to say. And I was thinking of turning this into a part series in which I can discuss more business-wise, going into the business sector of nursing, because that is our theme for this channel, and how one can obtain a nursing degree and still go into business in the field of nursing, which will be discussed in the next video. I hope you guys enjoyed this video. If you did, please give it a thumbs up and subscribe to the channel, and I'll be seeing more of you guys very, very soon. Yeah. Nurse Conley out. Wait, no. This is Student Nurse Conley signing out.